Hi, my name is Tamirica Shepherd, and I'm going to do a medication administration video for you guys today. So here's my badge. Now I'm going to scan the room. Okay, so normally for my medication administration planner, I would sit in the medication administration room, and I would try to avoid all interruptions. I would avoid taking any phone calls. I would keep talking to any of my colleagues to a minimum unless it's essential information. I would have the door of the medication room closed, and I would follow the no interruption zone policy. So the next thing I'm going to do is I'm going to compare my MAR to my patient care record form. Okay, so I'm going to compare the name. So it's Jaguar Jones. The patient is Jaguar Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. Medical record number 4176352. Medical record number 4176352. Allergies penicillin. Allergies penicillin. Now I'm going to read the order. So it is heparin, 5,000 units, 5,000 units, subcutaneously, every 12 hours, every 12 hours. Okay, so I'm going to put this patient care form to the side. And now I am going to perform hand hygiene. So now I'm going to do my first checkoff for the 7 rights of medication administration. So the first one is the right patient. So I have patient Jaguar Jones, date of birth 8/25/1963. So I am going to check for right medication. So our order is for heparin, 5,000 units subcutaneously every 12 hours. So I'm going to take my heparin valve, and it is heparin, and it is heparin 10,000 units per 1 milliliter, and its expiration date is December 5th, 2025. As you can see, it's heparin and the expiration date. Okay. So now I'm going to check for the right route. So it is heparin, 5,000 units subcutaneously every 12 hours. So the right route is subcutaneously, and I'm going to use my 1 milliliter TB syringe, 28 gauge. So now I am going to check for the right dose. So I'm going to calculate the dose. So like I said, it's heparin, 5,000 units subcutaneously every 12 hours. And this is heparin, 10,000 units per milliliter. And so we know that 5,000 units is half of 10,000 units. So half of 1 milliliter would be 0.5 milliliters. So now I'm going to clean my valve using the alcohol pad. Okay. So I'm going to pull out my syringe. I'm going to open it. Pull out my syringe. I'm going to take my cap off. I'm going to pull up the safety measure. It's done. And I'm going to aspirate 0.5 milliliters of air because that is the dose that we are administering today. Okay. So as you can see, I have 0.5 milliliters of air aspirated to the syringe. So now I am going to take off the safety. I'm going to grab my valve. I'm going to plunge it. And I'm going to release the air into the valve. I'm going to flip it open. And I'm going to pull out 0.5 milliliters. Okay. I'm going to put my safety back on. As you can see, I have 0. Can you see? I have 0. You see the 0.5 milliliters. There you go. There you go. So now I am going to replace my cap using the scoop method. And I'm going to replace the cap. So I am going to do a second check of accuracy. So I'm going to, so it's heparin, 5,000 units subcutaneously every 12 hours. And the heparin is 2,000 units per milliliter. We know that 5,000 units is half of 10,000 units, so half of 1 milliliter would be 0.5 milliliters. And I do have 0.5 milliliters in my syringe. So now I am going to move on. Oh, so normally I would have another nurse check my calculations and verify that I have enough solution in my syringe. So now I'm going to move on to the right time. So heparin is 5,000 units subcutaneously every 12 hours. So the time will be every 12 hours, and it has been 12 hours. So I can administer the medicine. So the next thing is the right indication. So my patient is immobile and they are at risk of blood clots. So I would give them heparin to prevent the blood clots. So now I am going to move on to the right documentation. So it is heparin 5,000 units subcutaneously every 12 hours, and this was entered into the MAR by the admitted physician, Dr. Southpaw, the MD. So now I am going to move on to my second check of the 7 rights of medication administration. So I am going to check the right patient. So it's Jaguar Jones, date of birth 8/25/1963. So now I'm going to check for right medication. So the order is for heparin 5,000 units subcutaneously every 12 hours, and I do have heparin in this 10,000 units per milliliter. So now I'm going to check for the right dose. So we got heparin 5,000 units subcutaneously every 12 hours, and we know that this is heparin 10,000 units per 1 milliliter. So we know that 5,000 units is half of 10,000 units, and half of 1 milliliter would be 0.5 milliliters. So in my valve, in my syringe, I do have 0.5 milliliters. So now I am going to move on to the right route. So it is given heparin 5,000 units subcutaneously every 12 hours. So the route is subcutaneously, and we are using our TB syringe, 28 gauge, 1 milliliter syringe, which is used for heparin. So now we're going to do the right right time. So it's going to be heparin 5,000 units subcutaneously every 12 hours. So it's given every 12 hours, and it has been 12 hours since our patient last got the medicine, so it is okay to administer the medicine. So now we're going to move on to right indication. Right indication, yes. So my patient is immobile, so they are at risk for blood clots. So we would give them heparin to prevent those blood clots. Now we're going to move on to right documentation. So it's heparin 5,000 units subcutaneously every 12 hours, and it was given by the admitted physician, Dr. Southpaw, MD. So now I am going to take the tape. And I'm going to label my syringe. So this is for patient Jaguar Jones. They are given heparin at 50,000 units. And that would be 0.5 milliliters. So I will take this and I will place it on my needle. On my syringe. And I'm going to take my MAR. I'm going to take my MAR and my syringe, and I'm going to go to my patient's room. This is my patient's room. I have my MAR, my patient's room, so I'm going to knock on the door. Hi, Mr. Jaguar Jones. I am here to give you a shot of heparin. I'm going to perform hand hygiene, and I will go over to the patient. I would lower their side rail and raise the bed to a working position, and then I would check for my third checkoff for the 7 rights of medication administration. So the first right is the right patient. So we have Mr. Jaguar Jones, and this is patient Jaguar Jones. We have date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352, medical record number 4176352, and allergies are penicillin, and we can see that he has an allergy to penicillin. So now I am going to move on to write medication. So I'm going to take this vial and I'm going to compare it to the MAR. So we have an order for heparin 5,000 units subcutaneously every 12 hours. In this vial we have heparin 10,000 units per milliliter. Expiration 12/5/2025. So we have heparin. So now I'm going to do the right dose. So heparin is given at 5,000 units subcutaneously every 12 hours. And we know that this heparin is 10,000 units per milliliter. We know that 5,000 units is half of 10,000 units. And we know so half of 1 milliliter would be 0.5 milliliters. And on here we have that the patient has heparin and is given 5,000 units, which is 0.5 milliliters. And we can see that there is 0.5 milliliters in the syringe. Now I'm going to check for the right route. So the heparin is given 5,000 units subcutaneously every 12 hours. So subcutaneously is the right route. We're going to check for the right time. So heparin 5,000 units subcutaneously is given every 12 hours. It has been 12 hours, so it's the right time. It's okay to administer to the patient. Now I'm going to move on to right indication. So my patient is immobile. They are at risk for blood clots. I'm going to give them heparin to prevent the blood clots. So now we're going to move on to right documentation. So it's heparin 5,000 units subcutaneously every 12 hours, and it was submitted by the admitted physician, Dr. Saul Paul, MD. So now I am going to put on my gloves. My goggles. And I am going to describe the location. So with heparin, we would give the shot at in the abdomen, 2 inches around the umbilicus, and we wouldn't go above the costal margins or below the pubic area, and we wouldn't go past the anterior superior iliac spine. So now I am going to take an alcohol pad. And I am going to clean around, going outward without touching the same spot. So I'm going to grab my syringe. I'm going to remove the cap and place it in the sharps container. I'm going to lower my safety. I'm going to pinch the skin. I'm going to put it in at a 90-degree angle. And I'm going to release it slowly. I'm going to pull it out, hold the pinch for 30 seconds, put this in my sharps container. I'm going to apply pressure to the place this in the container as well. So now I am going to lower the side rails. Raise the side rails. I'm going to lower the bed to its lowest position. I'm going to make sure my patient is comfortable. So now I'm going to remove my gloves. I'm going to check the patient for any allergic reactions, and I'm going to properly dispose of the gloves. Check my patient for any allergic reactions, and then I'm going to go document. The medication that was given, and I am going to indicate the response of the patient. Then I would go back in and reassess the patient to make sure that the proper response was given.